So today we're going to follow up from our last podcast where we talked about inflammation in the mouth and how it affects the mouth. Today we're fortunate to have Dr. Xerma ND talk to us today about how that inflammation in the mouth can actually move throughout the rest of the body.
Yeah.
And we know that inflammation is so important. We've chatted a little bit about it in the past, but let's just start with some of the basics. Inflammation. What are the problems? What are the challenges that we're seeing generally with inflammation?
That's a great question, Jen. And I like to compare inflammation with a flame. You know, we all have inflammation. We all need inflammation. Without inflammation, we cannot heal. That's the truth, right? Any kind of impact that we have in our bodies, that impact will trigger some sort of inflammation, which is a reaction of your immune system against that impact to bring you healing. Then I compare this to a flame.
Okay.
We all have this flame.
Mm-hmm.
The problem is this: when you have too much of this flame, too much of this inflammation, you start burning yourself, you start damaging yourself. That's a high inflammation. And sometimes that inflammation goes to places where you don't want it to be. For instance, in the cardiovascular system, it can cause terrible things. Atherosclerosis being the main one, right?
Okay.
Which is the development of this plaque inside the arteries. And ultimately, those plaques, those big buildups of calcium, cholesterol, they clog the artery, circulation stops, then the person might have stroke, myocardial infarction, some kidney failures because of that buildup. That is, in a nutshell, what inflammation could cause in the cardiovascular system, but of course, it goes to your brain. Alzheimer's disease is one of the problems of this high flame, high inflammation in your brain. Kidneys, kidney failure. To metabolic health, diabetes is one of the problems as well.
Okay. So this is good. So now we understand the basis of what's happening and let's talk about why it's happening. So how do we get more inflamed? Because then I want to connect the mouth to the rest of the body, but I want to understand a little bit more about, so how does somebody have increased inflammation? Because again, like you said, a little bit is okay, a lot is not. So why is it that we're talking about it a lot, we're hearing it in the media a lot? What is causing humanity to be more inflamed than maybe that they have in the past?
Great. Inflammation is not a new thing, right? We have known inflammation for a long time, but now it seems that inflammation is at the center as the pillar mechanism for many other diseases. And that is the big change now, because we see inflammation as the bottom line that is stemming, that is going through many other diseases. How a person gets inflammation is different, for instance, in your skin. You get a pimple, okay? This is a acute local event, but still, even it is in your skin, the inflammatory agents, the inflammatory fluids, they spread all over in your body. You might not feel this because it's just a small amount. You overcome this easily, that's fine. However, what about that chronic, low-grade inflammation that comes from, for instance, bacteria in your mouth? And you never knew it about those bacteria there, living there, just spreading those inflammatory agents across your body, affecting all the systems. And unless you have an awareness about this, you will never find this source. Mm-hmm. And unless you come to a professional that will look into your mouth, that will find the plaque, that will explore that potential source of bacteria, spread inflammation in your body, you never know about it.
So we know that inflammation, when we talk about in the mouth, does connect to the blood vessels, does actually spread to the rest of the body, right? Because I think in a lot of cases, at least for us, one of the challenges that we have sometimes in dentistry is that oral health is considered, oh, that's your mouth, and then we have doctors or naturopaths that help us with the rest of our body, and then the mouth is kind of something separate from the rest of our body. But I know what we're learning, and you're telling us, is that there's a connection between the mouth and the rest of the body.
Absolutely. Even in the past, medicine used it to segment the being, right?
Yeah.
So heart and vessels, the cardiologist, the kidneys for the nephrologist, the liver for the GI doctor. And actually what we see, especially in the integrative approach, in the naturopathic approach, all is connected.
Yeah.
This is not different from your skin, it's not different from your gut, it's not different from your lungs, it's not different from your mouth, right? Once you have inflammation somewhere in your body, even in your thoughts, because it has been shown by clinical research, a negative mindset, a negative thought can trigger inflammation in your body. Believe it or not. Yeah, if you have this kind of a friendship that is always hanging around you with a negative talk, well, watch yourself, because negative thoughts, they can trigger inflammation in your body. And especially now, because the topic is mouth, yes, indeed. If you have this, it's quite interesting. If you have this bacteria in your mouth, and we all have it, we need them, right? Like in your gut.
Yeah.
We need the bad ones, we need the good ones. And the thing is this, they have to live in balance, which is the homeostasis or eubiosis, right? When you have the unbalance, the predominance of the bad guys going over the good guys, this is called dysbiosis. When you lose the homeostasis, when you lose the balance, you have dysbiosis. Dysbiosis happens in your gut and also happens in your mouth. This is part of the GI tract, right? When you have too much of the bad guys overcoming the good guys. Then there are two ways the inflammation spreads from your mouth to your body. First, the agents of inflammation, this fluid, this secretion, the rest of the metabolism of these bacteria, they just spread around them. The blood vessels in your mouth, in your gums, will absorb them and we will spread across your body. This is one of the mechanisms. The second one is, I would say, even worse, because there is this event called translocation, when the bacteria itself leaves the mouth and enters a blood vessel and it spreads in your body. This is even worse. And those agents, they can enter your blood vessel, and once they enter into your blood vessel, they injure the lining of the blood vessels, which is called the endothelium, leading to endothelium dysfunction. This is the first step of a buildup of atherosclerosis, the plaque inside the arteries.
Interesting. So we can see that the connection of bacteria or bad inflammation, the bad bacteria that starts to take over, the imbalance, will move again into your gums, into your gut. And we know that a lot of people are having, gut issues as well, in terms of getting this nutritional food, or lack of nutrition, unfortunately, in most of the food that we're eating. But we need to be able to absorb good nutrition, otherwise we can't function as human beings, right? And a lot of this, I know there's a lot of thought around, leaky gut or these other issues that ultimately we're having. Does this all kind of trace back to that inflammation that we're having? Is this where this problem is coming from?
Absolutely. And it's funny because naturopathy used to call it the leaky gut syndrome. And this term was criticized by the conventional side, right? Because how do you classify leaky gut? Your gut cannot be leaky. Your gut has to be like something whole, bold, to contain everything inside. But then we had this gastroenterologist doing this clinical research, showing that certain types of stresses, like infection, bad food, and even some antibiotics that kill all the bacteria in your gut, not only the bad ones, but the good ones as well. Sometimes we need them, of course we need them, we go through them, then we go for recovery. But this kind of inflammation can destroy the walls of your gut, not in a way like making big holes, but small junctions in the cells of your gut, increasing the permeability. And that increase of permeability allows the content inside to go through your bloodstream, which is, again, translocation. For the lack of a better term, leaky gut seems quite reasonable.
Mm-hmm.
You have a wall that now is made more permeable, allowing some content from one side to translocate into your bloodstream through the other side. That's quite the same what happens in your mouth.
Okay. So we're now understanding that this is obviously quite serious. Inflammation throughout your body, really getting into your bloodstream, can cause a problem throughout your entire body. So, challenges in your mouth, challenges in your gut. We need to take care of ourselves necessarily a little bit better and manage some of these. So, apart from some of the basic stuff that obviously we talk about as dentists, coming in, getting your checkups, getting your cleanings, making sure that we are not just following some random, like come in twice a year or once a year. We're actually listening to our healthcare providers, both in the medical field and in the dental field, in terms of like, what is the best, procedure for you? How can we do this for you? So it's personalized medicine versus just a generalized, type of medicine. What else can we do? What else can we do to help ourselves decrease our inflammation that's not necessarily medical based, right? I mean, that's not necessarily procedural based. Are there things that we can do on a daily basis, on a weekly basis, on a monthly basis that will help us get less inflamed?
Absolutely, and this is like one of the cores that the naturopathic medicine does to boost your own system, to defend your own system, right? And this is one of the principles that we have. Few things that you can do. For instance, stress management, right? You have the responsibilities upon your own thoughts. I was saying a few minutes ago that even negative thoughts, they can trigger inflammation in your body. You can handle your thoughts. You can always watch your thoughts. Never go with the first thought that comes to your mind and follow that tendency. Criticize that thought. Put that thought into perspective. It is a good one, it is a bad one, it will bring me some benefit, will bring benefit for people around me. Is this a positive to go along with? That's great. Another thing, water. How much water do you drink per day? Like a river cannot flow without water, and we will start accumulate, building up all kinds of trash on the margin. The same, we need water to flow all the waste out of us as well, right? And sometimes it's not rare, unfortunately. I meet with people that drink like 1 glass or 2 glasses in a day. I mean, they can tell me they drink like 3 cups of coffee, but water per se, 1 or 2 glasses for an adult, I mean, that's not appropriate. You need water. Another thing, food. Food is very important. I could say that aside of your air that you breathe in and the thoughts that you have all the time, food, depending on the kind of food that you bring in, you are giving a tremendous chance to your body go well or to not do well, depending on the food that you bring in.
So what are some things, because I think that's a good one. I mean, water, there's only water, it's a certain thing, air, thoughts. With foods, are there certain things that we want to avoid?
Absolutely.
Okay, so what would we be avoiding to, again, try to keep that inflammation down?
This is quite well known, and we all should avoid as much as we can the high glycemic load, high glycemic index food, right? Those sweety things, those simple carbohydrates, and refined sugar at all means. That's not good at all. Especially the ones that are sticky, they will be there, okay? They will be feeding this bacteria inside your mouth. And there is one important information. The good bacteria do not benefit much from the bad food. The bad bacteria benefit the most from the bad food. So whenever you are bringing any kind of food into your mouth, remember which guy you are feeding now, the bad ones or the good ones, because at the end of the day, that might promote some dysbiosis in your mouth.
So, we talked about the foods that we want to avoid in the system, the sugary foods, the high glycemic foods, all the stuff that's really sticky. What are things that we can eat that would actually help us with inflammation? What are things that we should actually try to get more of into our system?
Yes. As long as you go high with a protein, good source of protein, right? And fiber and healthy fats, right? You are well covered. That will decrease the amount of inflammation that you are bringing into your body. Some people, they say to me, okay, Xerma, but those things are not tasty. I don't have a good tooth for those things. And you might be fooled because the sweetest, the food, if you have a high glycemic food in your plate, then your taste will be biased towards that food.
Right.
Once you make this switch to high protein, high fiber, high healthy fats, then you start like biasing your taste for that type of a healthy food as well. In the long run, you will be good.
Okay. So I think most people understand protein. We can get it from meats, we can get it from plant protein. When we talk about fiber, help me understand, what can I eat that's high in fiber?
Vegetables are the champions.
Okay.
The vegetables, zucchini, cucumber, chickpeas, green leaf, they are the champions.
Okay, awesome. And then when we talk about high, fat foods, what are we, good fats? What are we talking about there?
Fish
Okay.
at the top, right? Flaxseed, chia, and nuts. Yeah.
Okay, awesome. I think that'll also help us as we kind of make sure that we're, not feeding ourselves with bad stuff, but making sure that we're getting the good stuff in the
Indeed,
system.
yes, that's our goal.
Anything else that we can do to help decrease inflammation? So again, thoughts, water, food, air, anything else that we can do to help ourselves?
Exercises,
Okay.
always. Sleep. Sleep is huge. Sleep is medicine. Definitely, sleep is medicine. It helps to decrease your levels of cortisol. And cortisol, ultimately, if it is too high, cortisol is one of the main hormones of the stress, right? If it is too high, it decreases your immune response to anything.
Mhm.
So, if you are a stressed person going all the day in and out with high levels of cortisol, your immune system will decrease the ability to defend your body against those bad guys. So management of stress, sleep is a great one. Friendship to bring you joy, water, exercise, food, thoughts, I think they are. And of course, hygiene.
Yeah, awesome. Well, I think that gives us a lot to necessarily work on. I think that we've got, again, a lot of information from you. I appreciate the time and effort that you've
Thank you
given
so
us
much.
in terms of, educating us on inflammation, again, how it moves from our mouth or our gut into the rest of our body, and then how we can try to balance that out so that we can become healthier people.
Thank you so much.
Thank you
man.
for your time.
Thank you so much. I appreciate it.